Hey everybody, Dr. Jared Skowron from Spectrum Awakening. We got a lot of time now to talk about our next topic in our 2021 arching theme of helping your child with autism and working our way through biomedical different type of treatments. And obviously working with kids with autism is very, very involved. There's a lot of moving parts. We're gonna take every week, kind of break down certain things. We started off with genetics and why autism occurs. We got into some behavioral stuff. We got into MTHFR and some genetic testing for MTHFR and how to treat brain chemistry. Then I know we started talking about language. I think language was last week. So we're gonna move to another huge topic this week, which is gut work, digestion, pooping, yeast, candida, bacteria, parasites. So much is involved when we talk about healing the gut, or what they call the gut-brain axis, okay? Because our gut is a huge part of our health. It's a huge part that keeps us alive. It takes food from the outside world, breaks it down into tiny little pieces, and then absorbs all the stuff from our food so that our body can use it. And then it takes what it doesn't want, adds toxins to it, okay, so we can get rid of toxins, and we poop it out, okay? And that track, I mean, think of us, we're a donut, okay? We are actually a living donut because there is a hole in the middle of us, okay? And that hole is this huge, long garden hose that goes from our mouth, down our esophagus, to our stomach, small intestine, the liver and the pancreas dump chemicals in there. Then it weaves around and around and around and around and around in our small intestine where we're absorbing all of these nutrients. Then it goes to our large intestine, and that's the exit ramp out to the toilet, and our body dumps different toxins in there it doesn't want, and all of a sudden we poop it out. Okay, so we're a big long garden hose, and guess what? In that big long garden hose inside our body, it's dark, it's moist, and bugs grow, okay? Hopefully, they're good bugs, and those good bugs we call probiotics. Probiotics, or microbiome, is the new phrase of the day that basically talks about all the living things that live inside our intestines, live inside our stomach, live inside our sinuses, live on our skin, okay? These are living organisms, and a lot of the times they're helping us. They actually help digest our food, okay? When it comes to the small microscopic digestion, they also help with absorption. They also help with defense, okay? But sometimes the wrong bugs grow in that big long tube, all right? We're gonna get to that when we talk about prebiotics because, well, might as well now. Prebiotics, and I want to differentiate for you guys the difference between a probiotic and a prebiotic, okay? A probiotic are good living bugs inside our intestines. And again, there are actually 10 times as many probiotics inside our intestines than we have cells in our body. Some scientists want to take this living microbiome of living organisms and make it a whole organ system, cardiovascular and pulmonary and gastrointestinal and neurological and microbiome as an organ system that helps us. But either way, that's a semantical thing. Probiotics are the living bugs that live inside us, and the good ones help us, the bad ones hurt us. Prebiotics are the food that the probiotics eat. Okay, these are living organisms. They eat. What do they eat? They eat whatever we eat. They eat whatever food is raining down on them from their mouth. Hey, chicken nuggets and mac and cheese and a couple espressos and a glass of Cabernet, whatever it does. It comes pouring down on them and they choose there what to consume, okay? So prebiotics are the food that our probiotics eat. Now, prebiotics can be a wonderful therapy in and of themselves because certain bugs like to eat certain foods and other bugs like to eat other foods. And I use this metaphor a lot, but I think it really holds true. I live up here in the Northeast. It's cold in the winter. We just had 2 feet of snow the past 10 days. Most of the old people are gonna go down to Florida. They're gonna go down south where it's warmer because that's where they feel comfortable. And guess what? In the middle of summer, when it's humid and 110 degrees, they leave Florida and they come back up north where it's cooler, all right? Because they wanna be comfortable. Living organisms will do the same exact thing, not just humans, little bugs as well. So if the food is there that they like, they'll stay there. And if they don't get the food that they want, they'll go somewhere else, okay? So prebiotics are that food for our probiotics. And what they love to eat is carbs. Hey, who doesn't like carbs, okay? If you eat complex carbs, okay, if you eat whole grains, if you eat brown rice, you eat vegetables, that feeds the good, healthy bacteria. So the more healthy fiber you eat, the more healthy bugs you'll grow. If you eat a lot of sugar, if you eat a lot of candy, all right, sugar feeds the bad probiotics. They feed the bad bugs. So you eat the sugar, bad bugs will grow. You eat fiber, good bugs will grow. That's how it works, okay? Now, obviously, we can start taking these supplements. You can take a probiotic supplement, you can take a prebiotic supplement, or you may also be dealing with an infection. And these infections, are very common with our kids on the spectrum. And I think there's two reasons why. Number one, how do we keep these infections away? Okay, we keep these infections away with our immune system. But our immune system may not be as strong, or our kids' immune systems may not be as strong as we want it to, because it's affected by poor mitochondria. All right, so if we have a mitochondrial problem will give less energy to the immune system, which will prevent it from killing off these bugs that shouldn't be there. I think on top of that, we have a lot of our kids, and me myself, when I was growing up in the 70s, I had so many ear infections because I have a dairy sensitivity. Okay, dairy sensitivity causes chronic ear infections, which causes a bunch of that bubblegum pink amoxicillin to go down your throat when the kids are young. Blah, 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 blah. I can't imagine how many bottles of amoxicillin I had when I was little because of all the ear infections I had, because of all the dairy I had, okay? So if you had a lot of antibiotics, or your child had a lot of antibiotics when they were young, that's gonna kill off all bacteria, bad bacteria and good bacteria. It's gonna kill off your probiotics as well. That's gonna leave an empty place for other things to grow. And Candida can grow there, yeast can grow there, mold can grow there, other bad bacteria can grow there, parasites can grow there. So many different things can grow there. So that can add on to the problems, because when kids have those intestinal infections, it's going to affect a lot of things. It's going to cause pain. How many of your kids bend over? How many of your kids push on their belly? Okay? If there's pain, then they're not going to be paying attention to you. They're not going to want to do anything because they're in pain. How many times have I had a migraine? I'm like, I can't do a thing today because the pain is stopping my brain from working. Okay? The pain can stop our kids from wanting to be involved, wanting to do therapies, wanting to pay attention in school, etc. Add on to that the inflammation and the leaky gut that can occur with these infections that causes further big body problems. Okay, so last but not least, in addition to those infections, we got to make sure your poop gets out. Okay, and a lot of our kids are constipated. Some of our kids have diarrhea. We've got to get the poop moving. You've got to get poop moving all the time. So that's another issue as well. Now, when I talk to families about how do we get that poop moving, number one, you got to look at different foods and supplements, okay? Dairy and bananas are the two most constipating foods out there. Apples as well are pretty bad. Foods that loosen the stools. We've also, you want to use prunes, you want to use pears. Those are things that loosen the stools. From a supplement standpoint, things like calcium and iron will constipate. Things like magnesium and vitamin C will cause diarrhea. So you got to look at your food. You got to look at different balances of supplements as well. So that's just the overarching review. We're going to get into some more details, and then I'll answer as many live questions as we can within our hour. Okay. So let's kind of look at that big review again. Digestion, hugely important for our kids, for all of us. We eat food, it gets digested by different digestive enzymes. That's something else I forgot to mention, digestive enzymes. You gotta have the enzymes to digest your food, okay? You've gotta have the digestive enzymes there. If you don't have digestive enzymes, you end up getting a big bloated belly, okay? Because if you can't digest your foods, it'll sit there, it'll ferment, and it'll create gas. So we put food in there. The food is hopefully digested by our body, okay? Then we get to the point where we're meeting our probiotics. Hopefully the probiotics are the right kind. Hopefully they're being fed by the right fiber, the right prebiotics, or you've got some kind of infection. You got yeast, you have candida, you have mold, you have bacteria, you have parasites, and then we got to poop it out, and we might have constipation, diarrhea there. So all these different levels are involved with gut health, treating the gut, and helping our kids. So there's a lot involved. So that lends the question, where do I start? If I've got to worry about my digestion, about my probiotics, about my fiber and my prebiotics, and infections, and pooping, that's a lot to look at. Where do I start? Okay? You can start with testing. You don't have to, but you can. So the tests that I wanted to show you guys, we have we have 3 tests on our website that you can use. Now you can get these tests from your biomedical doctor if you have a doctor, but if you need the tests, then we have the tests on our website. Now the tests are only for people who live within the US through our website. You can get these test kits if you're international, other places, just not through us. But two different tests to consider. Number one is a stool test, okay? So here's a picture of the front page of the stool test that we use, okay? The stool test that we use will look at different categories of problems. This is just the cover page. Your actual test result will have about 10 to 12 different pages and very involved. The first thing it's going to look at is your digestion. Are you digesting your food? And if not, do you have undigested food in the poop? Do you have a big bloated belly every time you eat? You may want to add some digestive enzymes, okay? This test will look at that. Also, it's going to look for inflammation. Inflammation causes causes leaky gut, all right? We got to look for that inflammation, find the cause of that inflammation. Next, it's going to look at prebiotic levels, okay? It's going to look at the type of fiber that's coming out in your poop and if it's the good kind or the bad kind, okay? This is where you may have heard something called propionic acid. Propionic acid is a prebiotic that causes a lot of problems in our kids on the spectrum, okay? Not a lot of our kids have it, but if you do, you gotta change your prebiotics. This test will also look at your probiotics. It'll look at the good guys and see if, hey, you know what? We don't have enough probiotics. I should really take one, all right? Then it'll look for the infections. It looks for the Candida. It looks for the mold. It looks for the bacteria. It looks for the parasites. That's what you're gonna find on a stool test. So if you've got a kid, you know there's a gut problem, you haven't done the stool test yet, and you need one, you can get it from our website. All of the labs that you get on our website will come with a written interpretation by me. So I will take your lab, I will look at it, I'll interpret it, and I'll send you a written recommendation on what you should do about it. The other test you can consider is an OAT test. So the OAT test, and OAT is an acronym for organic acid test. The OAT test will help identify infections in the small intestine. The stool test is great at looking at large intestine infections. The OAT test is good for small intestines. Now, it's not as thorough as a stool test. It's not going to look at digestion. It's not going to look at probiotics. It's not going to look at prebiotics. It's not even going to look for parasites, but it will look for yeast and bacteria. So this is a sample report of the OAT test through Great Plains, which we have on our website if you need it. And it's got a whole section for yeast and mold, and it's got a whole section for bacterial infections. So this may help identify different infections as well if you need that kind of testing, if you need that kind of impetus to start treatment. Now, like I said, you don't have to have a problem you don't have to have a lab test to start the treatment. You can just do the treatments based on what you think is going on, okay? So the first thing I'll talk about, I'll kind of walk down as we walked down before. Digestion is the first thing we'll talk about, okay? Are you digesting your foods? If you have undigested food in your poop, I mean, corn is always there, all right? Blueberries are always there. But if you have other undigested food in your poop, okay? If you've got very mucousy, slimy poop, it's probably filled with a lot of fat, all right? You have a big bloated belly after you eat. Those are all signs you probably need a digestive enzyme. Now, we have 2 digestive enzymes on our website. There's obviously a load of digestive enzyme products on the market. What we have, again, we try to do things that are a little different. We have a chewable digestive enzyme, okay? I like this because it is chewable. It's a soft tablet and it tastes like papaya. So if your kid can handle the papaya flavor, it's a nice way to have a chewable enzyme instead of taking pills and opening them up. We also have an enzyme that is specifically for gluten, okay? So this enzyme digests gluten only. So if you're not on a gluten-free diet yet and your child's still eating gluten, could cause some digestive issues, you can take this to digest the gluten. You can also test both because the chewable enzyme won't digest gluten. You take them together if you want. Okay, next, probiotics versus prebiotics, okay? You want to make sure that you have the right probiotics. I know probiotics are very popular. There's a zillion probiotic products on the market. Ours is Gut Reset, okay? Why I like this one, and let me get my cheaters on, what I like about this one is a few things. Number one, the dose. It's 60 billion per serving, which is a nice hefty dose. It also has all the strains of lactobacillus, acidophilus that you want. It's got the strain of bifidus that you want. It also has Sac boulardii. So Sac boulardii is actually a probiotic yeast that will help with Candida. So it's got Saccharomyces and the Acidophilus and the Lactobacillus and the Bifidus, and it has no strep strains. Some probiotics have strep strains, which can kind of trigger pandas, so you gotta want to avoid that. And our probiotic also has a little prebiotic in it, okay? But if you are gonna do prebiotics, you either wanna add whole fiber and whole grains to your child's diet. But if they're not gonna do that, you get a prebiotic supplement, and we've got our prebiotic. Prebiotic Supreme, it's a combination of inulin, which is very popular, and arabinogalactan. So there are many different prebiotics out there. I like ours because it's more than just inulin, it's inulin and arabinogalactan. And arabinogalactan is also immune supporting, which is nice. All right. Next, if you've got leaky gut, or you think you have leaky gut, and it's tough to figure out symptoms of leaky gut, without a test. But if you think you do, you want to heal the intestinal lining. What leaky gut is our intestinal cells are right next to each other. But sometimes when they inflame, they kind of make a space. So it's quote unquote leaky. Things can go easier from the intestines into the bloodstream. You want to heal that. We use something called gut immune axis. Gut immune axis is a combo powder that'll heal leaky gut. It does contain glucosamine. Glucosamine is made from shellfish. So if you have a shellfish allergy, I wouldn't use this one. All right. Next, two more things. How do we kill the bugs? What if you have an infection, okay? And actually, before we get there, I wanted to show you two research studies. Didn't have time to pull a lot of them today, but was able to pull a couple. This one is a gut-to-brain interaction in autism, a randomized controlled trial on the role of probiotics. What they were able to do was look at different GI symptoms, severity of autism symptoms, behaviors, as well as different stool markers and psychological markers, as they saw probiotics help kids on the spectrum. Now, it's going to help kids more for those who need it and less for those who don't need it. But again, there's research behind it, which is nice. So let's say you want to kill off the bugs, okay? Maybe you've got a yeast infection, maybe it's mold, maybe it's bacteria, maybe it's parasites, all right? Candida is a type of yeast that's very, very common and prevalent. So we treat yeast in a lot of our kids. What I do recommend is using 3 separate things to kill any kind of infection. Number one, these bugs try to defend themselves. They secrete these chemicals that act as a disguise so the immune system doesn't find them. That's why I've talked to families who've been on nystatin or diflucan for a year or more. Why isn't it working, okay? Maybe you haven't dissolved that enzyme. It's called a biofilm, okay? So you need a biofilm enzyme. We have something called yeast mold biofilm that's gonna dissolve the enzyme. Then you gotta kill the bugs, all right? I use one of 2 things. We have a grapefruit seed extract, GFSE, and then we've got a soft gel of oregano, fennel, and ginger oil called No More Mr. Fun Guy. This is a recent one for it. It's a well-named product. I like that one. I forgot who named that for us, No More Mr. Fun Guy, but it's a good one. Then you're gonna get these behavioral side effects when these bugs are dying. These bugs die, they secrete their insides, and that causes a lot of pain, that causes behavioral problems. You're gonna wanna bind those. So you're gonna wanna use something called a binder. So we have a chlorella supplement we use as a binder. A lot of people also use activated charcoal, which is a nice binder as well to reduce the risk of those die-off reactions. But trust me, those die-off reactions are a bear. Anybody who's done yeast treatments knows this. But you can do what you gotta do. So hopefully killing off those bugs will help. And then again, we got our poop. You got to get your kids pooping. Ideal is once a day. A nice solid brown log is what we all want. That was my band name in college, soft brown log. So, you want to make sure that's good. Again, if you have diarrhea, you can firm it up with some calcium supplements. If you're constipated, which more of our kids are, I highly recommend magnesium instead of things like Miralax. So, we have a magnesium glycinate powder called MagPow. It's a nice way to help, regulate constipation. And again, I saw a comment here about Miralax. I'm no fan of Miralax. Now, what's interesting about Miralax, the main ingredient is propylene glycol. That's the same thing that they're using the COVID vaccine. They coat the RNA with propylene glycol. They're basically coating it with Miralax and injecting it into the body. So I find that interesting, and whether that potentially is creating some of these anaphylactic reactions we're seeing in some people who are having anaphylactic reactions to the shot. So it's intriguing. It's intriguing for us to think about. Okay, and last but not least, I had one last study, and then I'll go to the live questions. one last study about the biochemical rationale for the interaction between gastrointestinal yeast and autism. And what this was trying to do was explain why yeast create these problems in our kids. And let me see if I can highlight it very quickly. Is that, all right, hold on a second here. All right. Thank you for your patience. I want to make sure I highlight everything. Lindy just said propylene glycol. Isn't that antifreeze? No, Lindy, it's not, but it's close. So antifreeze is propylethylene glycol. It's not the same. It's similar, but it's not the same. So no, you're not taking antifreeze. All right, so this is I find science so interesting, okay? Yeast will produce ammonia, which interacts with the bad prebiotic propionic acid to produce beta-alanine, which is an amino acid. Beta-alanine can potentially go into the brain and become an antagonist for GABA. There's a lot of science there, but let me break it down for you. GABA is an anti-anxiety chemical in the brain. Okay, so the more GABA we have, the more cool and calm and chillax we are. Okay, but what can also stop GABA from working in the brain, what can stop the brain from feeling calm and safe, is this chemical that is produced by yeast. When yeast combined with the wrong prebiotic, because you're eating a bunch of sugar, that produces a chemical that stops your brain from being calm. Okay? That's an amazing scientific explanation. I never read that study before and actually didn't even know how that happened. But if that is the biochemical mechanism, it's really cool. Okay, that's how we can kill yeast and have behavioral changes, because you're actually changing brain chemistry action. It's amazing, amazing stuff. Okay, so that was I know it was a big Facebook Live. Geez, yeah, it was like good 20 minutes. So, again, we covered a lot of things. We covered digestion, prebiotics versus probiotics, infections, getting the poop out. So you want to make sure that you do it all for your child.